Have you ever been told that you have a heart murmur or a leaky heart valve? Have you ever seen an echo report that says you have trivial, mild, or even moderate valvular regurgitation or stenosis? Today, Dr. Lacey and I want to break down the basics of how your heart valves function, and then we want to guide you to know when these heart valve issues are nothing to stress over or when they may require some additional heart testing. Next on Living Heart Smart.
Hi, everyone. I'm Dr. Carolyn Lacey, and this is my co-host, Dr. Matt DeVane. We're practicing cardiologists, and we just want to bring this podcast to you to help you understand about your heart health. So, Matt, we're going to talk some fundamentals today, and you know how much I like the fundamentals.
But we always got to start there. That's
Yeah.
true. And when people, I think, when they think about their heart and heart disease and issues with their heart, most of the time it probably goes right to heart attacks, cholesterol, blood pressure. But heart
Totally.
valve issues, that's a major component of what we do every day. And so I think it makes a lot of sense for us to spend some time talking about valves today. And just as a reminder, the heart is made up of 4 different major components. There's the heart pumps that squeezes blood out to the body and to the lungs. There are the coronary arteries, which supply blood to the heart. There's the electrical system, which causes the heart to beat normally. And then there are the heart valves, which help direct blood flow traffic through the heart, which are super important. The 2 big heart valve issues that most people think about are aortic valve disease and mitral valve disease. We're going to cover those big time down the road in different episodes, but today we're just going to cover the basics.
I think that the most frequent question that I get asked in the office when I'm talking about heart valves is, I have a murmur.
Yeah.
What's a murmur? Right.
Heart murmur. When a doctor comes and listens to your heart, what they're listening for is the basic lub-dubs. We all know about the lub-dub of the heart. Well, that's the valve
Lub-dub.
opening and closing, right?
Lub-dub.
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 And then if we hear some turbulence of blood flow through the heart, that is what a heart murmur is. So that's an additional sound we're listening for between the lub-dubs that may tell us, oh, nice. I like that.
Lub-stubs.
It is that the in between.
Right.
That may mean there's a heart valve problem. Typically, it does not. I mean, 99% of people that I listen to with their hearts, I hear some sort of heart murmur. Most of the time, they're what we call innocent or benign or just normal blood flow through the heart. But sometimes it could mean that heart valve is having some issues and it's worth checking out.
When we hear a murmur, one of the things that we want to check out with your heart are your valves. And what are valves? So valves allow blood flow in one direction through your heart. And if you think about what the heart is supposed to do, it's a pump. So blood pumps out of the heart through the left, from the left side of the heart, and it pumps out oxygenated blood, has all the nutrients. It goes out to all the cells in the body where it uses the oxygen, and then blood flow that doesn't have enough oxygen comes back to the right side of the heart and then gets pumped out to the pulmonary arteries to pick up new oxygen. And that cycle repeats about 70 times a minute, about 100,000 times a day.
All day long, yeah.
All day long. You can do the rest of the math on that.
Yeah, at times 90
Right.
years, that's a few pumps and a few valves moving around.
That's a big number.
Yeah.
So we have 4 valves that help keep blood flowing in one direction, because if we didn't have valves, when blood flow would come back to our heart, it would just sort of swish back and forth. That doesn't do anything good. So we have 4 valves. We have 2 on the right side of the heart, the tricuspid valve and the pulmonic valve. And on the left side, we have the other 2, the mitral valve and the aortic valve.
Yeah, when I think of valves, most people think of valves as these little flaps or leaflet things. And yes, that's what valves are. They're made of 3 layers of connective tissue that are super strong and durable and a little bit flexible to allow blood flow through. But the valve leaflets are just one component of the valve structure. There's valve leaflets. Most of the valves have 3 or leaflets. One has 2 leaflets. And then there's the annulus that connects the valve leaflets to the heart itself. And there are some supporting structures, chordae tendineae and papillary muscles, that help keep the valve functioning normal as well. So when we think about heart valve disease, we're looking at the leaflets and the structure and the supporting tissues as well.
Matt, how do we look at the valves?
Yeah, well, if you were seeing a cardiologist, more likely than not that you're going to have an echocardiogram. An echo is the way we look at the heart valves. An echo or an echocardiogram is an ultrasound, just like they do ultrasounds of babies and gallbladders. We can do one of the heart, looks at the heart pump, the heart valves, the structure of the heart. And so it gives us a nice overview of how the structure and function of your valves is doing. And I think that's always a starting point. If you hear a murmur, if there's some concern about how the valve structure and function is or a leaky valve, the echocardiogram is going to be our test of choice to start the process out.
We actually did an episode on echocardiography. And
We
so
did.
if you check out episode number 15, it's called Demystifying Heart Tests, the Echo and the ECG. You can learn a whole lot more about
You
echocardiography.
can. I'll just mention here real quick that it's a non-invasive test. It's an outpatient test. It takes about 45 minutes. One of our technicians will be doing the study that knows exactly what we're looking for. There's a set protocol that we go through to
Right.
look at your heart valve and function. And then based on those results, shoots back to your cardiologist, and then they'll share the report with your primary care doctor and with you as well.
So when we're looking at the valves, though, when we're looking at them under echocardiography, we're really looking at two basic problems with the valve. And those words are regurgitation and stenosis. So why don't we do regurgitation
Yeah.
first?
Let me just say this. Regurgitation is the leakiness. Some people hear leaky
Right.
valves. That's regurgitation in the medical term, right?
So in order to keep blood flowing through one direction of our heart, our valves close. And when the valves are closed, they should not allow any backwards flow of blood. It should still
Yeah.
continue to go down through the heart. So that if you do see some of that backwards flow in the heart, that's what we call regurgitation. That's like the swishing back and forth that we talked about a couple
Yeah.
minutes ago.
Yeah. And I'll
Right.
just say also, when people hear about leakiness or regurgitation, they want to know, where's that blood going to if it's
Yeah.
leaking? It's not leaking out of your heart. It's just
Right.
leaking back to where it just came from.
I get asked that question too.
I know.
Yeah,
Where's it
it's
leaking? Oh my gosh.
where's it leaking?
No, just going back
No.
and forth was less efficient and ultimately could back up and lead to problems.
So we talked about the doors. We talked about the valves. Think about them as doors being closed. The other thing that doors do is they open, and we want our valves to open nice and wide to allow blood flow to come out of our heart unobstructed. Sometimes they don't open as well as they should. It's a little bit narrowed. So
Yeah.
instead of opening wide, it opens a little bit more like this, and that restricts blood flow coming out of our heart. That's called stenosis.
Yeah. And then
That's the other problem we're looking for.
exactly. Based on the two things, you can also imagine why that might cause a heart murmur, right? If the valve's not opening all the way, it's a little bit restricted. Blood has to shoot through that, narrowing a little bit more, and we can hear that sound. Or if it's leaking back where it just came from. Carolyn, I think we really want to help people understand what their echocardiogram reports really mean. Now, I don't want to go into detail there, but so much concern is happening because people are online reading their reports, which is great. I love it. But Dr. Google can be a little bit misleading. Well, we're going to grade the regurgitation or
Right.
stenosis. So there's a grading system in place based on a lot of different factors that we look at on the echo. And it's going to be graded either as trivial or trace, mild, moderate, severe, or somewhere in between those. Sometimes you'll see a mild to moderate. And that's
let
a
me
way.
interrupt you just a second here.
Please.
So one thing that we want to make clear is that once we identify regurgitation stenosis, then we have to take another step, and that's where that grading system comes in.
Right.
Okay.
Yeah.
All right.
Perfect. And then that also helps us decide where you are right now. Certainly trivial versus severe is a big difference, but it also helps us over time track the valve issues. Valve issues do tend to progress over time, but they tend to progress very, very slowly. So it's a way for us to track and trend how your heart valves are doing. Once we get these echo reports back, we have to decide what to do next, right?
Right.
So I think there's three major paths. A, do nothing. Hey, your heart valves look great. There's trivial leaky there, nothing to worry about.
That's an important one.
And that's a big one.
That's
And
a big one.
oftentimes that's where we end up just saying, hey,
It's okay.
we checked out your murmur and we're all good. B, hey, you do have a little bit of valve issue here, mild or moderate, whatever the number. And it's something that we need to track and trend over time. So you may be asked to do another echocardiogram in 1 year, 3 years, something like that down the road. And that's a very common way we approach these valve issues as well. Or C, hey, you've got some regurgitation or stenosis here that needs to be dealt with. It's almost never an emergency. Like I said earlier, these valve issues tend to progress very slowly. But if there's something there that's in the severe range or something that we didn't expect, you'll be hearing from your doctor about next steps.
We specifically aren't talking about what the treatment is if something is in your near future. That's because the treatments, actually, since we started practicing cardiology, they've changed quite a bit. And we'll go into the treatments when we're actually talking about the individual valve issue.
I'd say it's some of the biggest breakthroughs we've seen since we started this job is really how we deal with severe valve disease and replacements and fixing these things, but that's going to be a whole separate episode because it's super important. And we're going to bring in some specialists that want to talk about that as well.
Right. So now it's time for a little pep talk time, because one of the questions when people find that they have a valve problem and it may need to continue to be tracked over time, I always get asked, what can I do for my valves? The reality is there's nothing in particular you can do specifically to keep your valves healthy. They've started having a problem,
Yeah.
they're opening and closing. They're going to progress at
Well,
some
yeah,
point.
and what I say is that this is a mechanical problem that's ultimately going to need a mechanical fix. So drugs aren't typically used to prevent valve
Right.
problems or getting worse, and there's not much you can do about it. But you
Right.
do want to keep your heart and your body in the best shape it can be in case you do have to deal with a valve issue down the road with surgeries or procedures.
Right. So that comes to the basics that I tell everybody. I say it like
Yeah.
30 times a day. It feels
Yes,
like
I can vouch for that. You do.
I do. So, number one, if you don't smoke, don't do other drugs, back on alcohol use. That's basic
Less
number
is better,
one.
none is
Less
best.
is
Yes.
better, none is best. And then you really, number two, really work on having good nutrition, good overall nutrition for your body. Number three, you have to move, right? We have to move every day. Number
Well,
four,
can I just comment on the
yeah,
moving thing? Right. It's so important just to stay healthy. And we've talked about that before. But also, when you have a valve issue, it's important for us. One of the triggers for us to be more aggressive are symptoms. So the more that you move, the earlier you're going to detect any problems that
right,
may be coming up with your heart valve. So keep
right.
moving.
That's a good point.
Yeah.
I tell patients that all the time,
Yeah.
especially as I see valve problems progressing.
Yeah.
I get really specific. How much are you doing? How far are you walking? How long does it take you to do
Right.
that? And I write that down and keep it for the
Yeah.
next time.
And you need to be
Yeah,
consistent with it too, because it's so hard. A lot of these valve issues show up later in life. So then is it, well, I'm just
right.
getting old, so I'm slowing down or I'm deconditioned. So being very active consistently helps a lot in the long run.
Number four, we need good rest. We've taken it for granted for so many
Yes.
years. We need to have good rest.
Sleep, precious sleep, as
Sleep
you
is really
mentioned.
important, right? And I think there are a couple ways that, for you can be an advocate for yourself when you're taking these results and you're having the echocardiogram, you're taking them and talking with your doctor. For instance, if it wasn't a cardiologist that ordered your test, if you see words like moderate or severe, asking the question, is it time to have a cardiologist in my life?
Yeah.
That's probably an appropriate question to
Right.
ask.
Yes, I think
Right,
so. Yeah. I
right.
think that's other good news about people looking at the reports and being online and being more involved in the care is stimulating those questions with your physician about what does it mean and how concerned should I be and do I need a cardiologist to help sort things out a little bit?
And another question you should ask is, when is the appropriate next time for follow-up? Because then it helps get you thinking in the mindset, okay, I don't need another echo for 3 years. I'm okay.
Yeah, right.
Keep going.
Yeah, like we said, this is a
Right.
slowly progressive problem, and many people with mild or moderate disease never need anything done to their heart valves, but it
Right.
is worth tracking for sure. The only other thing, it seems like when I talk about valves, the most common thing people think about is mitral valve prolapse. It seemed like in the past, everybody was told they had mitral valve prolapse.
Everybody.
Yeah,
That should be an episode in and of.
our new echo techniques. We should talk about our echo techniques these days. They're so good. But the way we evaluate the mitral valve and prolapse is different than it used to be. So most people who are told they had prolapse really don't have it. And the technology is so good as well. That's why we're seeing so much of this trace or trivial or mild leakiness. That's just the technology of looking inside the heart and seeing this valve movement, seeing the blood moving back and forth is so good that we'll commonly see something going on in there. All right, Carolyn. Well, we talked about murmurs. We talked about leaky valves. We reviewed what an echocardiogram is and how that helps us look at your heart function and your heart valves as well. Hopefully, this will help patients feel a little more comfortable when they're looking at their echo reports or talking to their physician about their heart valve issues. So that was our goal today. We're going to spend more time on other valve issues down the road, but this is our basic overview.
Thanks, everybody, for listening to Living Heart Smart today. Again, I'm Dr. Carolyn Lacey, and this is my co-host, Dr. Matt DeVane. We're so glad that you joined us. If you have ideas for episodes that you want to hear about, please just let us know, and we'll start answering some questions. Thanks for the feedback.